If you've ever seen a drowning incident at a beach or at a pool, you know how scary they can be. In part because drowning can lead to respiratory and cardiac arrest, which is when the heart stops beating. Hi, I'm Dr. Vaillancourt, an emergency physician at the Ottawa Hospital. Over the next few minutes, I'm going to talk about drowning incidents and how they can lead to cardiac arrest. I will also explain what you can do to be prepared and hopefully avoid such an incident. Nearly 500 people die from drowning in Canada every year. It continues to be a significant public health concern. It is the #1 cause of death in children aged 1 to 4 years old. Many times, drowning can be prevented. Victims pulled from underwater are often unconscious and not breathing, or appear to be breathing and take an occasional gasp. Gasping or agonal breaths isn't normal breathing, and in fact is a sign of cardiac arrest. When a victim is unconscious and not breathing or not breathing normally, resuscitation efforts should be started right away. This involves calling 911 and immediately starting cardiopulmonary resuscitation or CPR and applying an automated external defibrillator or AED. Timely intervention can significantly improve outcomes. The best survival usually is achieved when we act within the first 5 minutes. Perhaps the biggest misconceptions are that drowning cannot happen when a lifeguard or lots of people are present, or that children will not drown in shallow water or if wearing water wings. This couldn't be more wrong. Before we conclude this video, I'd like to share 5 things to know about drowning. 1. It's important to know that drowning happens in seconds, and it often is silent. Usually swimmers go underwater and don't come back up again. It can take a long time or a long moment to recognize that a person is drowning. 2. It can happen to anyone who has access to water. All it takes is enough water to get your face into it. Children can drown in little kids' bath, in small plastic pools, or even in a bucket. 3. Remember, drowning is the most common cause of death in children aged 1 to 4 years old. 4. Prevention is key. Everyone should learn to swim, keep pool areas fenced in and closed. You should never be more than arm's length from toddlers around the water. Wear a life jacket and learn CPR and how to use an AED. 5. Even good swimmers can drown. They can get tired, knock their heads on something, get a cramp, have a medical emergency like chest pain or a seizure, or get stuck with something underwater. It's always a good idea to swim with someone else. It's important to know these things before going near water. Most of the time, drowning incidents can be prevented. As we wrap up, it's important to remember that drowning prevention is a collective responsibility. By raising awareness, implementing safety measures, and being vigilant around the water, we can stop drownings and their impact on our community. Thank you for joining us today, and stay safe around water.